That's an interesting scenario because most hospitals don't actually work that way. So the intensivist really isn't ever the admitting doctor. They're usually consulting. So there's two parts to this. I guess if the intensive care specialist is the admitting doctor, that's really local policy, and that's fine. The admitting doctor in that case would be the emergency specialist. So whoever the emergency consultant is with a provider number that can be used for referrals is the referring doctor, and this is what they use for admissions to the ward, for example. So the physicians, when they look after patients on the ward, they technically need a referral, and usually the referring person will be the ED specialist for them. So if you're the intensivist who nominally is the admitting VMO for the patient in ICU, then if you need a referral, then it would be the emergency specialist. The second part of the question, though, is why would you need a referral at all? And I would question the billing company that you're using, why you're being asked that, because most of the item numbers, other than consultations, so the 104, 105 um, item numbers and the other consult numbers, um, other than those, every single other item is a non-referred item. So you don't actually need a referral for those items or those services to be provided. They don't require a referral. And when the claim goes into Services Australia, it goes in with a hospital or a not required override for the referral part of the data set. Um, the only other thing that actually does require a referral, if it's a referred service, is ultrasound. So if you're providing diagnostic ultrasound services that have actually been requested by somebody else, then yes, you do need either a specialist referral or a diagnostic imaging request. They're basically both referrals for our purposes. Um, but having said that, most intensive care specialists, when they do ultrasound, they do that as part of their own practice on their own patients, which means that the service really is not a referred service; it's a self-deemed service. So you send the ultrasound items in to Services Australia with a self-deemed override, and again, then you don't need a referral for that. So to answer the question in short, it will be the ED consultant who would be the referring doctor if you do need one. But I would question your billing company why they actually asking for a referring doctor for those items.